Hi, I'm Marta Katalenas. I'm a primary care pediatrician in Round Rock, Texas. I had my practice for many years, 25, and now I am lucky enough to be part of the Dell children.
What part of the Time for Genetics initiative has helped you the most and why?
Well, I think reminding me that genetics is there, reminding me to think about genetics. The review of all diseases, these are all rare. Most of them are rare disorders that we don't see in primary care on a daily basis, but you have to keep in mind. And reminded me to check out how to access the experts. It gave me access to those experts. So it's always good to have a big panel of people you can call with a question, or you can send an email with a question. Here in Central Texas, we are fortunate enough to have geneticists, but they are very busy. We don't have enough throughout the nation. And I would like to remind geneticists to make us primary care their allies, their we are trainable, so we can be their helpers. And the world of genetics is changing so fast that we are going to need that continuous input from them, and educating us and keeping up with the new information that is coming out there.
What would you tell a colleague or another pediatrician or primary care practitioner in the Mountain States region about the Time for Genetics initiative, if they should be part of it?
Well, I definitely think they should be part of this. I learned a lot. As I say, I review all disorders that didn't come to mind until I went over it. Some of these disorders are rare, so I had the opportunity to review them, and it's just having that help there. I think the genetic world is changing. We primary care need to be informed. We need to know what tests are available there, how to order them. Can we order them? Sometimes we don't have access to a geneticist to ask these questions. And so I think educating us is a big part of this project. And that's what I have been doing. I have been re-educating myself in genetics. So I will encourage everybody to join, definitely. I think the more states we can participate, the more we can learn about what the challenges are in other regions. I think it's a great project that should continue, and I will definitely be part of it. Yes.
How has being part of the Time for Genetics initiative impacted the way you interact with families that you serve through your clinic?
Well, I think just what I was telling you before, just being aware of it, it made me look into the genetic possibilities when I'm talking to families, feel more up to date in what I can offer these families, and giving them even the option of, okay, let me check into this, I'll check with the geneticist and come back to you. I mean, that alone is a huge change. And knowing that genetics, that was that little corner over there that we all learned, but it changed so much that we don't know where we are at. Just having the possibility of filling that gap and having access is what really I noticed with my patients. I feel more comfortable talking about the possibility of a genetic disorder and what tests are there to rule it in or out.
Any specific, not giving any patient information or names or anything, but can you think of any specific patients that something you learned either from the red flags for genetics or developmental delays or Ehlers-Danlos syndrome topic areas, that any of those resources or things that you learned through the webinars were helpful for you in a patient visit?
Oh yes, especially the signs of genetic disorders. I think that is a great educational point for primary cares to remind us. I learned a lot from that. And I'm thinking about newborn that I had with weakness, just generalized hypotonia. and how I was able to differential diagnosis and think about what genetic disorders could be, what test or what physical exam I will do on this baby to rule in or out. And it turns out the geneticists end up seeing this baby. So I think it helped me in my primary care, just having that presence that, okay, genetic, is this genetic? That's what made me think now all the time, while before maybe it didn't happen 100% of the time.
Wonderful. That's perfect. And so I'll just ask you if there's anything else that you would like to share that you think would be helpful for either the Mountain States folks that work with us every day, just getting feedback or hearing about the program, but then also anyone else that's interested in it. Is there any other thoughts? Is there any favorite parts? Do you like the newsletter, the webinar, the mailer, or the family-centered part best, or any of those tidbits?
Well, I think the whole program was put together so well that every single piece that you mentioned is helpful and it's very well done.